Hey guys, it's the Doc, and here's our next installment of the hashtag Ask Dr. Mudgil series of posts. This one comes in from TikTok. It comes in from CJZ65, and the question is, what do you do for abscesses? Do you need antibiotics? Well, that's a good question. So the first step is, if you have something that you think is an abscess, you need to get your ass in to see a doctor. It's very, very important because abscesses typically are bacterial infections. And it's a multi-step process in treating these. So typically the first step is you do something called an incision and drainage to kind of drain the pus out of the abscess. The next most important step is obtaining a culture of what drains out, which we send off to a lab to determine if there is a bacterial infection and what antibiotic would be the best choice if antibiotics are needed. And the last part of the question is, are antibiotics needed? Well, that's actually a good question. So usually for isolated abscesses, incision and drainage really is all the treatment that you need. Typically, I will put my patients empirically on a broad spectrum antibiotic to keep them covered until the culture results come back, which can take a few days. If the culture is negative, then my patients can just do a very short course of antibiotics and get off of them. If the culture indicates that the antibiotic I prescribed was not the right antibiotic, then obviously I'll need to switch the antibiotic. But you really need to get into your doctor if you have an abscess so that they can do the appropriate procedures and tests to treat you in the most appropriate way possible. For folks that get recurrent abscesses, it's also very important for you to see your doctor because there are some strategies to help you mitigate that. So CJ, I hope that answers your question. Let's get it.